it doesn't matter the season, it is not uncommon to have watery eyes, stuffy noses, and scratchy throats. But you don't have to live with those conditions. Today's CI Health sponsor is Gibson Area Hospital, and joining us today, Dr. Jonathan Glickstein. He's got some more information for us. Welcome.
Thank you very much.
Okay. Now that spring has officially sprung, I'm going to guess you're going to start getting a little busier now with people and their spring seasonal allergies.
Yeah, there's no question, and certainly as we even get out into the garages and into our yards and do some cleanup, there's some mold that you'll kick up and certainly some dust that'll trigger symptoms.
Yeah, so let's talk about symptoms, because I think everyone now with COVID-19 on the brain, how do you differentiate between, oh, I've got COVID, or nah, this is just allergies? This happens every spring or summer.
Sure. So a patient is probably in some ways their best source of information. So if they know that every spring that they have these types of symptoms with itchy, watery eyes and sneezing and congestion, that's certainly going to be a clue. However, fever, bothersome cough, and other new symptoms that would not be typical for your spring allergies that you'd had in the past might clue you in that you need to get tested.
Yeah, and earlier I just mentioned, that there is a solution for these type of symptoms that you may have, whether they be seasonal allergies or other ear, nose, and throat issues.
Absolutely.
But there is hope, and there is help for you. So let's talk about the services that you provide as an ENT.
Sure, absolutely. So number one, we try to educate patients. And so whether or not you need to take a medication or not really ultimately is up to the patient. I mean, many of our symptoms are bothersome to us, but we shouldn't feel obligated to have to take a medication for it. But I can certainly help patients know what types of medications may be helpful. One of the biggest reasons I find that medicines aren't effective is actually that the patients give up on them a little too soon. So typically the nasal steroid sprays patients may use once or twice and go, didn't really work, but often you may need 7 to 14 days, and really I offer patients, I tell them the advice to take it for a month before you're sure that it's not going to work.
Yeah, because a lot of people don't like to use nose spray.
No, indeed.
But they are so helpful, being an allergy sufferer myself.
Yeah.
So, but it's not just allergies that you address. I mean, it's like ear ringing and ear infections and nosebleeds. There's a whole list of things that you can help people with when it comes to their ear, nose, and throat.
Absolutely. So the neat thing about our specialty is we could see newborns potentially with hearing loss all the way up to our senior citizens who have lots of life experience and noise exposure over their life. And we have a team that we're assembling with audiologists who can test their hearing while they're there, and of course do thorough examinations on my part to determine what exactly may be going on with their ears. But one good thing, if there are, we like to look for silver linings with COVID, is the rate of ear infections in children and even in strep throat in children really is anecdotally gone down because of the fact that we're wearing masks and socially distancing and things like that. So
really?
Yeah, so that's been actually kind of a silver lining.
Huh.
Yeah.
That's fascinating. I could see the strep throat, but ear infections, how is wearing a mask maybe helping with an ear infection?
Absolutely. So the way that germs get into your ears is through your nose. And so
all connected up in there.
It is, especially if you're a little tiny person. And so your eustachian tube, which is the connection in the back of your nose to your ear, is how germs make it into the ear space. And
okay. That makes sense. Okay, but if somebody does need a tonsillectomy, you also do surgery there?
Absolutely.
So
yeah.
another option.
We offer surgical care for ear, nose, and throat problems for both benign and malignant disease if at all occurring. So hopefully not.
Okay, you're at Gibson Area Hospital there in Gibson City.
Yes.
So what does it mean to be working at Gibson Area Hospital?
Well, I'll tell you what, it's a real engaged community of people. There's been, in my experience, just an amazing level of positivity in the staff and willingness to help people, and that was something that really drew me to the area.
Well, that's wonderful. Welcome to the area if you're new.
Yeah.
And if you have any questions, maybe it's not allergies, maybe it is, and you want to figure it out, we will connect you with everything happening at Gibson Area Hospital. There was a look at their Facebook page as well as their website at ours, CILiving.tv.